It's 1:30 on June 26th. This is Janet at the Rock Island County Health Department. Thank you for joining us so quickly. We wanted to get some important information out to you as quickly as possible. Nita, will you tell us about today's numbers in Rock Island County, please?
Sure. For today, we are reporting 20 new cases of COVID-19 in Rock Island County. That is up from the last couple of days of numbers, and so our total right now is 861 total cases of COVID-19 in Rock Island County with 28 deaths, and we have currently 6 people hospitalized in Rock Island County.
Okay, first we're going to hear from Amy Thoreson with the Scott County Health Department. Please go ahead, Amy.
In Scott County, our current number reported on the Iowa Department of Public Health's website is 532 cases. That's up from 473 when we talked to you on Wednesday. Over the last few months, I've been asked by family and friends if COVID-19 was keeping me up at night. For the most part, I've been able to say no. The community response to COVID-19 was good. Our numbers did not climb at the rate of others, and most importantly, while any death is too many, the number who lost their lives to this illness was not as many as in other places. That was not the case last night. Yesterday, the positive case reports kept coming in like winnings on a slot machine. We have never seen anything like it, and I have colleagues who have been here for over 40 years. Yesterday alone, 40 cases were identified in Scott County, and some cases are still being investigated. This is approximately 6% of the cases we have identified since our first positive case on March 21st, and is equal to 15% or equivalent to this of the cases in April at our peak. At that time, COVID-19 was scary, but not real to many in our community, because it wasn't yet personal. Well, it's real now. It's pretty hard to scroll through social media or check email without seeing a message of a store, restaurant, bar, fitness center reporting cases and their plans for closing and cleaning. I would imagine that many of you now know someone or has heard of someone with a positive case. As a community, we need to act now. We've invited Dr. Ludwig Katz, our medical director, to share some information on the surge of cases that has taken place in the last week, and more significantly, yesterday and continuing in today. Dr. Katz?
Thanks, Amy. So we'll show you the epidemic curve that we're using. It's 1 day of update from what was in the paper yesterday. These are some symptomatic cases and epidemiologically linked cases. So the numbers are smaller than what you're hearing about test positive. But if you look at the far right, you can see it's just headed straight up, essentially. That flat part on the far right is a mistake we made when we formatted the graph. It's an average that includes no input for the next several days. So ignore it and just look out to the approximately the 22nd. The moving average is accurate. When we complete data entry today and tomorrow morning, my suspicion is that we're going to be off this graph, that will be above the 18 that you're looking at on the vertical axis, but that remains to be seen. So we're surging. This is not the second wave. This is our failure to control the first wave. 3/4 of these patients are asymptomatic. So we know that these cases that we're counting represent infections that occurred within the last 7 to 14 days. So we have sustained brisk community transmission. Some people have tried to explain recent increases across the country and locally as the result of increased testing. Obviously, that is not the case because our epidemic curve, the epidemic curve that we're using most extensively is exclusively people with illness, positive test and illness. So this is not an artifact of increased testing. 3/4 of the reports that we're receiving are in fact currently symptomatic, again, demonstrating that this is ongoing recent transmission. Hospitals are beginning to see an increase in admissions. Every time I talk to somebody at Genesis or Unity Point, the number changes. There are a number of patients hospitalized on both sides of the river. Most of these people are on medical surgical units, very little ICU activity to date. Realize that intensive care unit requirements, the need for ventilators generally follows an increase in hospitalizations by 5 to 10 days. That is, it takes that long for a person with illness to evolve to the stage where ventilatory support and intensive care are needed. So over the next 7 to 10 days, we're going to see stress in the hospital system. We really just don't know how much at this point. There's a major change in the epidemiology of what we're seeing. In April and May, the average age of our symptomatic cases approached 60, 59 years during April and May. The average since last week is in fact 29. This is teens and young adults who are becoming infected now, and it correlates, is associated very nicely with quote unquote opening up after our initial April and May interventions to flatten the curve. As most of us on the call probably recognize, teens and young adults are invulnerable. They are going out for entertainment to restaurants, bars, and other entertainment venues, and they are ignoring public health advice for mitigation of the pandemic, including social distancing, hand hygiene, and face shields and masks. It's a very strong message that this is going to get worse if this group of people does not begin to act responsibly. We are continuing to encourage testing, most particularly of people with symptoms and their close contacts and essential workers. The goal of this is so that we can find people who are test positive, interview them, find out who their contacts are, and provide advice both to the cases and their contacts about how to stop it from spreading. Once again, self-isolation and quarantine, hand hygiene, social distancing, and barriers. I want to make an important point about barriers for the public who are not cases. This is source control. A mask on me is to prevent me from infecting somebody else. I think you need to look at every asymptomatic person in the community as a loaded gun. We don't allow people to point loaded guns at other people, and we shouldn't be in public venues where social distancing is impossible or difficult without a mask. If I had my druthers, we would have a mandatory masking ordinance. I am not empowered, and the health department is not empowered by the state of Iowa to do that, but that is frankly what I would do. In addition, I would reimpose all of the social distancing initiatives that were present prior to reopening. We'll have to wait and see what Springfield and Des Moines do as this situation evolves. Critical issue is if you get a call from the health department, you need to pick up the phone and you need to cooperate with our questions so that we can find the people most capable of spreading this infection in the community. We are currently jeopardizing very, very important priorities like school reopening at the end of August with this surge. And the economic and social consequences of kids not being able to go to school, I think we all recognize, are profound. Other things like liberalization of access to long-term care facilities by families and other healthcare providers is being jeopardized. The long-term return of business to normal is being jeopardized because as we have a surge now, we see more businesses that have to close because they don't have enough staff to stay open. The economic consequences will be worse in the long haul than if we can get things under control now. So once again, our preferred approach at the health department is to return to more extensive mitigation requirements, most particularly social distancing, hand hygiene, masking in public venues, minimizing gatherings of 10 or more people, minimizing contact in the community that isn't critical. That's what I have to say.
Thank you, Dr. Katz. Next, we will hear from Nita Ludwig with the Rock Island County Health Department. Please go ahead, Nita. Nita, can you unmute yourself?
I'm so sorry. So in recent weeks in Rock Island County, we had seen our case numbers decline, and now we are seeing that they are also starting to rise again. We have had some early indications that one of our outbreaks, which we spoke about earlier, is from the East Moline Correctional Center, and we do have early indications that their infections are rising, and we hope to give you more accurate information tomorrow as it becomes available later today. And Illinois, of course, is moving to phase 4 of Governor Pritzker's Restore Illinois plan today, and for the most part, Illinoisans have been taking public health advice to prevent further spread of COVID-19. But today, like we said, we are reporting 20 new COVID-19 cases, and this is concerning. Since Sunday, we have had 54 positive tests, and many patients have become infected because they were being lax on the social distancing and wearing face coverings that we've just talked about. Until there's an effective treatment or vaccine, those two actions, along with frequent hand washing, are the best ways we have to keep our community well. We've said all along that the Restore Illinois plan allows for us to return to phase 3 or even phase 2 based upon our case counts and other metrics. Our residents' actions directly dictate the direction of our state, and none of us certainly want to go back to phase 3 or phase 2. In addition to our prevention advice, the best way to get this virus under control is to have robust testing and contact tracing. The Rock Island County Health Department has significantly increased our contact tracing ability. Starting Monday, a community-based COVID-19 drive-through testing site will open for Illinois residents, and that will be at the Quad City Expo Center parking lot at 2621 4th Avenue in Rock Island. Testing is expected to remain available through Friday, July 10th, except for the 4th of July. The hours will be 8:30 to 4:30, and face coverings are required to come to the testing site. And we certainly encourage anyone on the Illinois side of the river to take advantage of that testing site and be tested. They are going to be using the anterior nasal swabs for this clinic, and so they are somewhat less invasive than the nasopharyngeal type of swab. And they are going to be testing regardless of symptoms or not. No appointment or doctor referral is required for that. Photo ID is required, and contact information is required so that we can get results to the people that are being tested. Testing is available at no cost to the individual, but those with medical insurance are asked to please provide their medical card or insurance card at the time. Due to the demand of this service, there could be significant wait times, but please be patient. We highly encourage everyone to take advantage of this temporary testing site. Thank you.
Thank you, Nita. And again, we'll hear from Amy Thoreson with the Scott County Health Department.
Surges in cases that we're talking about today mean that we need to act as a community right now to prevent further outbreaks from occurring. Teens and young adults, I know that COVID-19 situation has been a real pain for you. Summer is about fun, hanging out with friends, and enjoying some freedom. But your schools and colleges want to open up this fall. Your jobs need you there, and businesses want to stay open. Your friends want to finish their baseball and softball seasons and play sports in the fall, and your grandparents want to see you. None of this is possible if you are sick or if there's a lot of community spread occurring. Please don't gather in large groups. When you do gather, keep 6 feet apart from your friends. Wear a face covering. If you are sick or a contact to a case, don't go out. Parents, talk to your teens and young adults about staying safe. The average age, as Dr. Katz said, of cases since Sunday is 29. But 1/3 of those cases have been in those aged 22 and under. They have to understand how important it is to protect themselves and the community. What they do matters. Businesses, we know this has been incredibly hard on you, but things are not back to normal. Please review your policies and practices for keeping customers 6 feet apart and strongly consider recommending face coverings for individuals that visit you. If you have sick staff or staff identified as contacts to cases, don't ask them to come to work. They need to be home for the isolation period. We will issue formal public health orders if we are not getting support from businesses. Consumers, when you go to a business and it's crowded and you can't practice social distancing, don't stay. Support the business through curbside or delivery or come back later. To all of us, now is not the time to back off. Keep your group small, wash your hands. If you're getting tested for COVID-19, stay home until you know your results. If you are out and about, find a way to keep your distance from others. Wear a face covering if you can't keep your distance. We want to keep our community open and starting to recover. We want to keep our medical system from becoming overwhelmed. This will not happen if we do not make changes to our behavior now. We can do this, but we have got to get it together, QC. Thank you.
Thank you to Dr. Katz, Amy, and Nita for your information today. We did have some questions that came into us prior to the first part of this briefing, and we encourage any of the media on the call to put questions into the chat so that we can answer them for you as you're preparing to share this information with the public. We do have a first question, and perhaps, Amy, you can respond to this. Some businesses and restaurants are choosing to close or limit some services because of positive cases. Is this recommended by health officials, or is this more of a personal choice?
We meet and talk with restaurant owners, bar owners when we have these cases. They certainly need to close down for deep cleaning. It depends on the volume of cases, whether they can continue to stay open or if the number of staff have been exposed. So it's a joint effort in addressing how we respond to those cases and concerns.
We had a follow-up question to that said some businesses are closing because they just want to limit exposure to customers and their employees, not because the business itself has positive cases. Do health officials believe that's effective?
Well, we saw decreased cases when some of those facilities were closed earlier, and we're continuing to see cases associated with bars in particular, and so we believe that those businesses are certainly being prudent in their decisions at this time.
And then a follow-up on contact tracing. Has contact tracing shown where, in general terms, these cases are happening? Dr. Katz mentioned entertainment venues. There's also the question of protests, bars, baseball games.
Who do you want to answer?
Go ahead.
Well, we have a number of bars and restaurants that appear to be nidus for significant transmission. Doesn't explain all of them, and as people have increased their activity, they go a lot of places, but clearly entertainment venues, bars, restaurants, and others are very important at this point. The protests nationally have not yet been associated with significant transmission. The reason for that is probably very complex, partly because there's some degree of dispersal after the protests subside, so people go other places, and making the association gets difficult. Probably more important is that these are outdoor events, and the risk of transmission outdoors is much less than the risk of transmission indoors. So we don't think protests yet have been shown to contribute materially to this. We're really focused on places where young adults are gathering shoulder to shoulder without appropriate barriers, hand washing, distancing.
Amy, perhaps you can answer this next question. Have any businesses been cited for staying open or not doing deep cleaning, et cetera? Can you explain the process when you're working with a business if they have a positive case?
So when we talk to the business, we give them the recommendations, the CDC guidance. As inspectors of food service programs, they're usually very responsive to our concerns about cleaning and getting those things taken care of. We have found a few that aren't as receptive as we would like them to be. But at this point, no one has been cited for something like that.
Okay, we have a question here we'll put to Dr. Katz. Is Davenport's mass gathering for fireworks still advisable?
Any mass gathering that brings people from unrelated households close together is inadvisable. If social distancing can be maintained and appropriate barriers are used, it can be made safe. We're currently working with a number of groups for mass events in later on in July and August that we hope to be able to hold safely. July 4th is coming fairly quickly. I can't ban the fireworks show. All I can do is ask the organizers to consider very carefully whether they should cancel and consult with the health department. If you want to watch the fireworks, if they go on and you want to watch them, you have a responsibility to keep yourself and your family and household members safe by social distancing and the other measures that we have discussed. If somebody asks me, should we have a mass event on July 4th, the answer is no.
Amy, can you connect back on this last question? It says, are there any ways to adequately trace back to protests? And I'm assuming that would be through the contact tracing at this point.
We are asking everyone that we interview if they've been at a protest or a rally. So we are looking for that information. It is not a source that we're hearing reported to us very much at all.
Okay, we'll give it about 30 more seconds if there's any additional questions from our media on the call. Okay, seeing no additional questions, we're going to conclude the briefing. Please know that the recording of this briefing will be posted on the Scott County Health Department's website under COVID-19 News. So you should find that there in about 20 minutes. And then we'll also be posting information on our Facebook page. We do again encourage all of you to help us share this important message with the community and encourage them to visit the Iowa Department of Public Health and CDC's websites for additional guidance beyond what has been provided here. So thank you all for joining us on short notice today. Have a good afternoon.